Influenza cases have increased nationwide in recent weeks, according to the Centers for Disease Control and Prevention. All U.S. states except Hawaii have reported widespread outbreaks of the flu, and the trend could continue for several more weeks.
So it's good to know how to prevent it, identify it, and treat it. Valley News Team's Lisa Bedeau has some advice on how to avoid getting sick and remedies to consider if you start feeling sick.
A very contagious strain of influenza type A called H3N2 has been causing most of the cases of the flu in the U.S. and is associated with more hospitalizations and more deaths than other strains, according to the CDC.
This year, you already have 2 patients in the hospital with the influenza A, actually.
People at high risk for flu complications include people 65 or older, those with a compromised immune system or a chronic health condition like asthma, heart or lung disease, and children under 5. It's recommended they take an antiviral medication as soon as possible.
The sooner that you fight it, the sooner that it works. Later on, it lingers and it takes longer to work because the virus is already built up.
For those not at high risk for complications, getting enough rest and staying hydrated should be enough to fight the flu. If you have a fever, headache, or body aches, opt for over-the-counter pain relievers like acetaminophen, ibuprofen, or naproxen. Consumer Reports health experts say it's not too late to get the flu vaccine.
It can lessen the risk of complications and hospitalization if you do get the flu.
Other ways to prevent getting the flu: use a humidifier to keep the humidity at 30 to 50%, since the virus survives best in dry air. And wash your hands often with soap and water.
Don't touch your eyes, nose, or mouth to avoid transferring any virus you might have on your hands. And cover your sneeze or cough with your elbow if you don't have a tissue handy.
Lisa Bedeau, Valley News Live.
Consumer Reports warns to avoid cough suppressants and antibiotics, which don't work for viral infections and can contribute to antibiotic-resistant bacteria. See your doctor if your flu symptoms improve, but then fever returns and your cough worsens, or if you experience difficulty breathing, pain in the chest or abdomen, and severe or persistent vomiting. This may be a sign of secondary infections, such as pneumonia.